We're getting a look now at the promised report coming from Health and Human Services Secretary Robert Kennedy Jr. and his prescription, if you will, for tackling chronic illness among America's children. The White House commissioned the report, and in it, just released yesterday, it spotlights several factors driving this problem: poor diet, environmental chemicals, lack of physical activity, chronic stress, and what it describes as over-medicalization. The report calls for better nutrition and more exercise, a review of pesticides, and getting ultra-processed foods out of kids' diets as some of the solutions. The report also calls for a new vaccine framework for children that will ensure, quote, America has the best childhood vaccine schedule. Also are now calling for a review of injuries associated with vaccines. Let's talk more about this with the commissioner, the FDA commissioner, Dr. Marty Makary. Commissioner, thank you for being here. In your view, what is the most important element of this report? What recommendation is going to bring about the greatest change?
Well, look, Kate, the current healthcare system is not working. The population is getting sicker and we keep spending more money. We've got to change the agenda. We've got to start talking about things that we haven't talked about in the past. The root causes of why so many young kids are on medication, why so many are depressed and have prediabetes or diabetes. So this report moves into areas we've never moved into before in healthcare at the federal, national level in terms of funding priorities and our priorities at the FDA. Talking about micronutrients, food as medicine, the microbiome, which is a central organ of health that we rarely talked about in medical school. It talks about microplastics and natural light exposure for young children. It talks about screen time. It talks about the importance of soil and the types of foods you get and the fiber content. We're rewriting the food pyramid at the FDA along with USDA. We're going to end the 50-year war on natural saturated fat. We are talking about ultra-processed foods and fiber, things we have not talked about in the past. And as a matter of fact, the food pyramid was broken and promoted misinformation that may have paralleled the rise in obesity and diabetes because of that misinformation.
The goal of helping America's children be healthier, happier, live better lives, take less medication, these are all goals that you can be sure that everyone agrees on. But I have heard people who looked at this report and the lead up to it especially, that it lacks teeth on some very important areas of how you get to your end goal. What do you say to those who say it's lacking teeth on how you're going to get rid of pesticides, how you're going to get rid of ultra-processed foods? What do you say?
Well, first of all, you have to remember we live in a very politically polarized time where if we literally approve the cure for cancer at the FDA, you'd have some people criticizing it. We heard those criticisms when we took action to remove all 9 petroleum-based food dyes from the U.S. food supply. We were told that there's no teeth, this is just talk. And look where we are today here. The vast majority of U.S. food makers have complied and have given us an action plan that we're tracking on our FDA website. The same with so many of the other things we're doing. We're getting so much done. At the FDA, you're going to see cures and meaningful treatments at a pace you've never seen before because of a new pathway where we get decisions out in weeks. You're seeing a new dietary guidance. You're seeing SNAP waivers. For the first time ever, states can use their food stamp dollars or assistance dollars and say they're not going to go for sugary drinks and junk food. So you're actually seeing a lot of progress, and this MAHA report sets the agenda in a very specific way with 128 action items.
I want to ask you about SNAP because part of the report calls for boosting healthy food options through SNAP in a couple of ways. I have heard experts across the board agree on the need for that. But President Trump just signed a law that is bringing about deep cuts to that very program. Do you see a contradiction in the solution and the problem here?
Look, we spend $400 million plus a day on food programs in the United States at the federal level. And there's nonstop ongoing discussions about what portion of that should be shared by the states. Nobody wants to cut funding to food programs or assistance programs. But we have to think about how to do things differently. You know, we spend more on healthcare than any other country in the world.
Right,
and
but
look
how
at the
do you
outcomes
get
that we
healthy
have.
food options to people through SNAP when healthier options are often more expensive options if you're also kicking people off of SNAP and cutting millions and millions of dollars from the program that it says SNAP is mentioned multiple times in the report and the strategy and solutions of needing is an important priority to help make America's children healthier?
Well, first of all, there are no cuts to the program. It's a matter of sharing with the states. But take milk, for example. Because of broken guidance from the federal government, from our health agencies, schools have had regulations that they cannot sell too much whole milk. They have to remove the fat because we thought fat caused heart disease. It was medical dogma. It was not based on science. It was groupthink, like you saw during COVID with cloth masks and ignoring natural immunity. Groupthink. And we're saying let's use some scientific standards. So we're going to remove some of those regulations so that schools can serve local foods, fresh foods, organic foods. You know, it doesn't make sense that we have oranges brought in from Brazil for orange juice in the United States. We changed regulation at the FDA to enable Florida and Louisiana and Texas and California oranges to be used by changing the it was a regulatory failure. So we got to do things in a smarter way.
On vaccines, the World Health Organization and pretty much every country in the world considers pregnancy to be a high-risk condition for severe COVID. You and the Secretary have just changed recommendations now, saying that pregnant women are not recommended to get a COVID vaccine. I've heard from multiple doctors, Commissioner, saying that they are hearing from pregnant women that they are unable to get the vaccine now because of this change in recommendation. What should a pregnant woman do if she wants to get a COVID vaccine, if this is the case?
Well, first of all, Kate, we've been very clear that anybody who wants a vaccine can get a vaccine, but our job at the FDA
it's not.
is
They're
to
not.
approve.
You heard that from members of Congress. You heard that from you've absolutely heard that from members of Congress when they even spoke to Robert Kennedy Jr. about that. That is not. You may want them to be able to get it if they want to, but because of the way the guidance has been rolled out and the way the recommendation has been pulled back, they are not able to, either because pharmacists are afraid of liability or insurance is not covering it. It is not. If everybody wants it, they're not able to get it.
Well, Kate, first of all, there is absolutely no regulatory barrier preventing somebody from getting it whatsoever. Now, you can't get it at every Starbucks, but there is no rule that somebody cannot get it. What we have is a regulatory framework at the FDA that says we have to approve pharmaceutical claims based on the data that they presented to us. And so that's the standard. Now, some say we should just close our eyes and blindly rubber stamp COVID vaccines in perpetuity every year without any updated clinical trial data. We've said we want a clinical trial. And the data in pregnancy, just to talk about pregnancy for a second, is very mixed. Show me a randomized controlled trial in pregnant women. That is the gold standard of science, Kate. And if you look at the one randomized controlled trial that was done with the COVID vaccine, it was mysteriously closed mid-trial. Those results were not made
change
public.
That recommendation,
and nobody really has good data.
Guidance
for example,
of ACIP.
Has any pregnant woman died of COVID last year? Has any healthy pregnant woman died of COVID last year? Now, if a woman has a comorbid risk factor for COVID bad outcome, then they would meet the indicated criteria for the COVID vaccine. That would be part of the indicated label. But a healthy pregnant woman, has any healthy pregnant woman died of COVID last year? We are getting the data that was never made available before, including adverse event data. That is, young people who have died from the COVID vaccine. And we're going to make that available to the medical community in full transparency, because this is the question that Americans are asking. Remember, 85% of healthcare workers said no to the COVID booster last fall. What does that tell you? People want to see more data, and they don't want any more dogma.
They do want your leadership, absolutely, Commissioner. FDA approves vaccine. The FDA is the gold standard in terms of approving vaccines. Just as baseline, since this is the topic, Secretary Kennedy, before he was secretary, had said that there's no vaccine that is safe and effective. Do you agree with that?
Well, look, with every single medical product, I can just tell you as a physician, what we have to do is evaluate the safety to risk benefit ratio. That is, every single product in all of medicine has some side effect profile, and for some it's rare. And so that's the general framework, and that's what I think he was referring to. You know, we took yesterday a massive step, and this is sort of the big story, is that we took the biggest step to rein in pharmaceutical ads in the history of the FDA yesterday. And we believe that people are not getting an adequate description of the side effects, of the risks, of the potential harms in many of these ads. They're always singing and dancing. They dominate the news airwaves. It's a barrage. People are just seeing people singing and dancing. America spends $10 billion a year on pharmaceutical ads. We're asking the pharmaceutical companies to take that $10 billion and use that money to lower drug prices for everyday Americans. It's a massive priority for President Trump. It's 20 to 25% of the budget of pharmaceutical companies goes to marketing. We want to see lower drug prices, and we want to see the decisions on what products an individual gets, be it a vaccine or anything else, live with a doctor and a patient, or a doctor and the parent of a patient. We think the government is not your doctor. These are discussions that doctors make with good data.